The U.S. public health system is in crisis. Experts are being fired, research is being put on hold, and virus season is coming. So what will all this mean for the U.S., and what's this going to mean for Canada? Dr. Donald Vinh is an infectious disease specialist at the MUHC. Hi, Don.
Hi, Mitsumi.
So, Don, we talk about virus season. What does that mean exactly?
Well, back to school means back to viruses, right? So right now, the two major viruses that are circulating in Quebec are rhinovirus, which causes the common cold, and of course, COVID. But what we're starting to see is a double-digit number of cases for adenovirus, flu, and RSV, all of which can cause respiratory tract infections.
You mentioned RSV. What can we do to protect ourselves against that?
So there are actually two important public health interventions that target RSV. In babies, there is a monoclonal antibody that has been shown to significantly decrease the risk of severe disease. So this is a long-acting antibody that requires only one injection. And the Quebec Ministry of Health has really done a wonderful job here because it is offered free during the RSV season, so that's fall and winter, for babies born after April of the current year, babies who are premature or who have any at-risk conditions. The other intervention is an RSV vaccine, and right now the Quebec Ministry of Health offers it free of charge to at-risk senior adults. And the data so far shows that a single dose of the vaccine prevents associated hospitalizations over at least 2 RSV seasons. So that's great news. There are, of course, other at-risk groups who are not seniors, and for now they can get the vaccine, but it is not free of charge.
We're still hearing more about people coming down with COVID now. What is the situation with COVID here in Quebec?
You know, it's a bit less clear right now. Between late March and early September, there was less surveillance of COVID cases and less reporting of which variants were circulating. But what we've seen since September is an uptick from about 460 reported cases at the start of the month to around 600 just a week later. Now, in the U.S., changes in policy have led to uncertainty about what vaccines will be available. But here in Canada, we know that an updated COVID vaccine, one that targets the LP 8.1 variant, has been shown to boost antibody levels within 2 weeks. Health Canada has just approved it, and manufacturers are aiming for it to be available here in Quebec this fall. So now, provinces will still need to set their recommendations on who will be eligible and who will get coverage under a public health program. And hopefully those decisions will be guided by solid scientific evidence and not by misinformation or pseudoscience, as we're seeing, unfortunately, elsewhere.
Well, yeah, the vaccine research has really taken a hit in the United States. Is that going to affect our ability to get a vaccine at all here, do you think?
Fortunately, no. So the major vaccine manufacturers that have previously provided Canada with the flu, RSV, and COVID vaccines, they all have gone ahead. They've updated their products for the 2025-26 season. They've done the research to show that these vaccines are efficacious, and they're producing them on the usual schedule that we've come to expect. So while politics in the U.S. is downplaying these viruses, Canada's public health response has stayed very steady, and vaccination here continues like business as usual.
We're hearing reports of outbreaks of measles and polio in the United States. There are reports that the rates of vaccinations for children are down in the United States. What does this mean for children here?
Yeah, so the resurgence of measles, whooping cough, and other vaccine-preventable diseases in the U.S. is tragic. Kids are getting sick, hospitalized, some have died, and it's all because of misinformation. But even more alarming, Canada has already had more than 3 times the measles cases seen in the U.S. So here we've had nearly 5,000 cases. That tells us that the anti-vaccine movement isn't just an American problem. It's here too. It's widespread, and it's fueling these outbreaks. And when one vaccine-preventable disease makes a comeback, it's a warning sign that others could follow. So now, if we had vaccination rates being where they should be, these diseases wouldn't stand a chance. But the spread of anti-vaccine sentiment means we need to do a better job educating the public about the real benefits of vaccines, because strong vaccine confidence is how we're going to stop these outbreaks.
So overall, Don, what kind of effects do you think we can expect to see here in Canada, given what's happening to the health system in the United States?
The problem here is that many countries look to the CDC and the FDA in the US for guidance. So when US policy falters, they're left to fend for themselves. In Canada, we're a little bit buttressed from this. Our federal and provincial programs that review, procure, and make medications and vaccines available, that provides us with much more stability. But the greater issue is that Canadian scientists still rely on close partnerships with US scientists. And the danger when you have shifts in American policy is that they could stall those collaborations and they can cause setbacks in Canadian science and in Canadian public health. Mitsumi, it's like losing a sneaker in the middle of a marathon. You can still move forward, but man, it just got a whole lot unsteadier and slower. And that's what Canada is going to have to deal with for the next few years.
Okay, thank you very much for this, Don.
Thank you, Mitsumi.